Grounded in research, individually focused, and back at last. Welcome to the Thriving with Stripes podcast.
All right, welcome back if you are a former listener of the Thriving with Stripes podcast. My name's Tom Stott. I'm sitting alongside Dr. Patty Stott. Good morning.
Good morning.
We are giving this thing a go again. The podcast is back.
Mm-hmm.
It's back for a number of reasons. What is some of the vibe or feel with your intentions to kick this off with getting this podcast up and going again?
Yeah, just to, I think, stimulate conversation and spread information, hopefully a little bit quicker. I feel like there's been such a boom of things that are being released in the research world regarding connective tissue, but it's not hitting our providers as quickly. So, and I know it's hard to read journal articles, right? So maybe we can kind of expand on that information within our talks. And I think that there's some interesting topics to talk about with other providers at some point too. Yeah.
I enjoy a conversation and a little bit of extrovertedness. So I have missed this podcast. I appreciate it being back. And I think we're both in a better space to be able to present material and feel comfortable with it and kind of have a conversation about it rather than it just right off the bat, it feels less scripted for me.
A lot less scripted, or this is what the articles say, but well, yes, but now this is what 5 additional years of working with patients.
The application. Yeah, that's what I was trying to
and
get
we
at.
have a lot of application, I feel like, within our practice. So
Cool. Well, it's probably a good idea for the first time listeners or the people that have maybe been sent this podcast to say a little bit about who we are and kind of what we do, kind of a little bit of our shtick, our specialties, our superpowers.
sure.
You want to kick it off or would you like me to go?
I can start.
Okay.
So I'm Patty Stott. I started out as a physical therapist many years ago now, over 20 years ago, in the orthopedic field, and had my diagnosis actually of all of these things. Well, I guess not all of them, right? My diagnosis of EDS, just EDS, not a classification, happened when I was still in college. So it was a little while ago. I think it was back in 2002 I got my diagnosis. And it was just, yeah, you have EDS. That's pretty cool. And you're bendy, and have a nice day in life. And cool. You have a label.
No real explanation, no dot connecting made yet, just
Only joints.
very superficial.
Only bendy. Only, yeah, that's okay. Yeah, things pop out and you have injuries, and that explains it.
And you were a pretty high level athlete. So thinking you were like, oh, cool, that's probably why my shoulder is exploding. Is that kind of about as far as your brain took the...
Sure. It was after a failed shoulder surgery. Actually, it was a capsular shift. They tried to tighten it, and it didn't work. And years later, because we were going through physical therapy school, right? And I was always the model for all of the tests because I had the positive ligamentous test. Everything is bendy, and I don't necessarily look hypermobile, right? And that's where I really want to explore in this podcast, these misconceptions, or what we think this should look like. I'm very hypermobile, but I'm not necessarily flexible. And there's a difference, and the combination also is not great. So things pop out a lot for me, and they have for quite some time. And I have a history of hernias and weird things as a kid, and dislocations of my radial head, the elbow, when I was little, and so did my sister. So a lot of it sprinkled into my youth. I have a lot of the classical EDS, connective tissue disorder, in my history. But even so, when I was 20, I guess at that point, it was still just you're bendy. And I think it's really exploded in the understanding that this is actually a connective tissue disorder. And what does that mean? And that's next.
how deep does that go?
Right. And we're going to start to explore that in our next, really first podcast, that we kind of talk about things in the connective tissue world and why I'm so passionate about it. Because my hypermobility was frustrating, but my connective tissue disorder that felt like it was progressing, right, is what took me down, and was really difficult to find a better baseline from. But through the work that I do with patients, through the years of experience I've had with my own health, and refusing to accept that it couldn't change, I have made very good progress myself and do with other patients as well. It's just really different depending on the story. But physical therapist,
Yeah.
back to the question, physical therapist is where I started, and that's where we met. Actually, was in a physical therapy practice, different offices, but the same company. And it was outpatient orthopedics. I loved sports. I loved physical activity. I loved movement. And for a while, I kept that up without thinking about, the consequences of possibly taking better care of my body, which we'll explore in other
Sure.
podcasts in the future too. And for a while, I was getting away with it, right? Because my population that I was seeing were athletes, because we worked with orthopedic surgeons, like sports med surgeons. And looking back now, I'm just like, oh my gosh, I can't believe it was so cookie cutter what we did, but it worked for some people. And being the person with EDS, I was given all the patients with EDS, or the more complex ones, or the ones that things weren't working for. And like I saw the difference there, like even back early in my career, like these patients are just different. Like
I
I,
remember you writing, because I was an aide or a tech at the company. I remember you writing, we'd have a general format. I do think, sure, we were cookie cutter in overall like approach, but I think we were well researched. Like I really enjoy
yeah,
the progression that our even practice, grew and showed there. But I remember doing like working with some of your patients through some of the charts you wrote. I'm like, Patty has a lot more isometrics, or like you were even, I remember now reflecting, you like trying to explore what would work better for some of these people that shoulder blade retraction with TheraBand just was not it for.
yeah, yeah. So, and that did it. It worked. We had a great job. We worked for great people. Something at some point over the years, we were like, this just isn't working. We need to move. And it was around that time. It was when we moved. It was 2017, and a little bit before that, though, things were trickling out in the research, and I did keep up to date on things that were coming out within this population even back then, and through my patients as well, right? When you hear somebody come in and they're like, oh, the local, yet like one of our big specialists happened to be in the area at the same time back then, it told me I had mast cell activation disorder. I'm like, oh, tell me more. So the research was trickling and coming out at that point, and then really exploded in 2017 with the reclassifications, the diagnostic criteria that came out. So um, that's about when we moved. And when I came out here, and people are like, well, what's your specialty? And I'm like, well, I mean, EDS is definitely my specialty, but I do orthopedics. I really started getting all the EDS patients. And also not being in a sports med clinic and being in a general orthopedic type of clinic, like, standard physical therapy is, you're welcoming to all people. It's not just athletes, which is what we saw before. I started realizing that these patients were very different. That these patients had cerebral spinal fluid pressure problems. They had, I had a lot, especially when I first moved out here, and this still happens, right? That were just losing or gaining weight, and like it had nothing to do with the food that they were putting in or their exercise. And there were just a lot of other problems that were popping up that my brain kept saying, yeah, but adipose tissue is connective tissue, right? Or, neurological tissue is connective tissue, right? Like, how is this not connected? And I had the same thing in my journey throughout the years too, right? Like I was very, very severely gaslit by a gastroenterologist that was apparently very good at his job with typical patients. But and I said to this doctor, I'm like, you don't think that my symptoms have anything to do with EDS? And he's like, no, that has nothing to do with Ehlers-Danlos syndrome. This has nothing to do with your gut tissue. And I was like, but isn't that connective tissue? So I'm just a person that always wants to know why does my patient have pseudotuber cerebri, which is what they, were referring to as cranial pressure problems
Yeah.
back years ago. Why do they have that? What in connective tissue would cause that change? I just always want to know why, because if we know the why, we might be able to put people into remission. So my practice grew eventually. Well, within somebody else's practice. And then I realized that I just needed more time with my patients. And I just also had a huge health flare myself. I have a book out. It's all in the book, guys. It's Dare to Dazzle, my journey. But inflammation, we'll talk about this in the next one. Inflammation has a lot to do with connective tissue disease and disorder. It's a lot to do with what looks like progression. So I started realizing that in my own story a while ago, and with my patients, and realized I needed a more whole health view. And I went back to school and I ended up doing functional medicine and herbalism. And I already have a background in athletic training and in hand therapy. And I have a lot of like hats that I wear for the community that just kept growing and building up. My manual techniques changed to things that are working better for this population, like visceral work and fascial counterstrain and cranial sacral therapy, and things that actually help restore the health of the connective tissue locally in a more gentle way
Sure.
to reset the balance. So I see people with connective tissue disorders. I see them from not just a physical therapy standpoint. I see them first from a standpoint of why is your connective tissue with the increased risk factors genetically? Why have you gotten to this point sitting in my chair in the office? And I say I only see people with connective tissue disorders, but right then their family members have people that kind of look like they have it, but they don't, and nothing else has worked. So I do
And
still
sure,
see
at minimum, like something's destabilized or
in connective
slightly off.
tissue,
Yeah,
right? Like it happens
right.
to a lot of people. So
Yeah, I'm thinking back now to the move, and we moved here in 2017 to the Denver, Colorado area, and now I'm thinking, because we've always wondered, like, why did we do that? I mean, I don't, in like a
yeah,
positive like question, not like a questioning question, but I'm like, what if? Because you're right, we did primarily see in a sports orthopedic clinic, it was probably 80% athletic population. We saw a good deal of patients that needed joint replacement, but even most of those patients were like, I need to get at it, like
right.
kind of athlete mindset. And maybe part of moving out here was to help us grow that space of like kind of reaching everybody and
Mm,
just getting into that availability to be able to see people that like, hey, I've completely lost my athletic identification. Like maybe I used to, but now I feel like I'm stuck in my house most of the time, and I have motorized like a wheelchair, but it's just not working for me. And
yeah. Yeah, I think you always look back and you're like, why did I move?
yeah,
And
across the country.
to get sick in a house that made me sick and made everything worse. And, my own personal story, again, I wrote a medical memoir about this that has like tips, of course, of
Right.
like connective tissue health within it. But, ended up with the neurological phenotype of like, you name it, is what just kept piling onto my system. And tethered cord presentation, upper cervical instability, um, low riding cerebellar tonsils, like a lot of the neurological stuff, right? And that's what like give me a pause for a moment. It's a bad brain day, but it's the brain was the worst of it. The brain was horrible and horrific, and we just don't talk about that. We talk about Chiari malformation, right? And we talk about cord tethering, which again we'll come
Sure.
back to those, because that really is just a change in the health of the local connective tissue from for a lot of people a variety of things, but the systemic inflammation that happens that disrupts the extracellular matrix. But we don't talk about the brain stuff enough. And I needed my brain back. It's coming back. It's slow, right? This is an off day for me. But we don't talk about these things enough. There's so much that we don't talk about enough. And now where I am in my practice, and I am a clinician, right? So we do the podcast, write books, like we're doing a lot of stuff, right? Which is why you'll probably see me in my pajamas most of the time when we're recording, comfy clothes, because it's in between something. Um, but I am a clinician. I see patients at least 30 hours a week. and I have all of my projects on top of that. At this point in my career, I see most of the patients that have not found help elsewhere. So I know we talk about that neurological phenotype is really only present like in 11%, I think was the stats from is that the Petrucci article from about the phenotypes that we have when you have all of these neurological overlapping issues and multiple systemic things going on. It's about 11% of the people that have hypermobile EDS. That's at least 50% of my practice. I'm not saying it's 50% of
Right.
people and the article is wrong. I'm saying that because of the work that I do, I tend to see the people that cannot find help elsewhere, which is probably means that nobody has worked on the health of the connective tissue, and that is my specialty. So that's me. I do lots of things in the EDS world.
You had mentioned some of I know you brought up your book, but you've written 2 books. We have Taming the Zebra.
Taming the Zebra, Volume 1. And this afternoon, I'm writing the cranial chapter. We're going on to cervical, so we're trying to get Volume 2 out. That's going to be a good one. Yeah.
And then you had mentioned your medical memoir in Dare to Dazzle.
Yes.
That's like your story, your journey, that's sprinkled in with stories and like, hey, I found this out. I came across this modality or tool or treatment that you show kind of how it applied to healing in your journey.
In my journey, but like that's what I always tell people is that I usually don't say anything about my journey until I have tried it with other people or heard from other people, because I don't feel like my opinion should be worth very much. It's when my opinion also continues to be reinforced by other people's experiences. And that's where, like, when I work on, and I do have some publications with some other people out there, like, that's what I prefer is I might think that I know what I'm doing with tethered cord, but where are the other people? Tell me what you're doing with tethered cord that's successful. So
yeah. And then on the research side, you just started to mention that, and also in the continuing education side with a couple companies.
Yeah. So I teach as well. And again, I try to find people to teach with, right? Because a lot of the stuff is complicated, it's complex, and I don't know everything, right? Like recently, I paired up with Amy Morris to work on abdominal conditions, abdominal vascular compressions. We work with a company called MedBridge. I have some stuff on home CEU for the providers, but patients can watch them. But we made like a 3-course series. I feel like I have more in-depth knowledge with understanding why somebody will develop something like this. And Amy really had a lot of practicality of, yes, and when you find this in the body, this is what you might want to start with. When you find this, so she's got really the physical experience of working with these patients much more than I do. But we do have upper cervical instability ones that just came out, cranial, a lot of stuff on MedBridge. I think that we have 15 courses by now. Susan Shalala has joined me. Heather Purdon has joined me. So that's what, like, I really, I mean, I value my
like
opinion,
the Avengers
right? But
assembly.
right, it is, but we have to get together and we have to like bounce ideas off each other. So,
and then the only other thing I was thinking of was EDS Echo.
oh yeah, I do that too. So EDS Echo, for everybody's always like, where do I learn more? Read all the articles out there. That's what I do. The articles and the books and extrapolating ideas from articles on extracellular matrix, not just connective tissue disorders. But yeah, the Echo program is actually really helpful because it's a gathering of minds and it's a variety, right? Some are really beginners and some have been in this EDS world for a while. But we get together and bounce ideas off of each other and we bring up case studies. We always start with like a topic, but I help host some of them, right? Usually the systemic ones and sometimes like the master class. But Leslie Russick is the one who primarily runs those and coordinates those. So, right, it's the Avengers. We have like an Avengers team on group texted or emailed this morning just on some tethered cord stuff. So we try to.
Sorry, I'm thinking like Zebra Avengers, but this is messed up, but like, when the Avengers portal in on like Doctor Strange's like wand and they just jump in, like the wand portal will open, but somebody's horizontal and they're like, hey, I'm gonna do this meeting from the couch today because I'm not feeling it.
Yes,
somebody else is
that's
like,
us.
I got a pressure
That's
problem,
us.
you're gonna have to bear with me, I'm just gonna type today.
That's us. Yeah, our Avengers team is mostly people that have something in the HSD and EDS group. So this is like really tough for us, right? It's really tough for us to get this stuff out. And I'd love to have all these people on at some time also to show you like the work that these people are doing. It's tough to do this stuff. It's tough to do this when you have the underlying condition, but there are some people out there getting it done. And then like other members of our group, family members might have it. So there's really a passion and a drive within the group that I work with.
Yeah, no, it's a pretty special group of people.
Yeah, you've
As I've
gotten to
like
meet
come to
them.
know them, I've now
So,
taken some
okay,
classes
so
with them.
yeah, let's move over to you. Tell us about you because your path is a little bit different. And for those that don't know, us as a duo in the office too, I tell people, look, I can help with connective tissue health. I can help put people back together. I'm very much a manual therapist, alignment, things like that. I can start people off with some basics of exercise, but my specialty has moved so far away from what you do and what I used to do that I want somebody with more expertise, which is you, the biomechanics one. So
Yeah, I'd probably say that's where my skills, and I've really enjoyed like broadening my skill set. I'd probably say first and foremost, I mean, I have the background that you do. We met each other like sports orthopedic, outpatient, busy, lots of people coming in and out, busy environment, team environment. I loved every bit of that. And I'd probably kind of say twofold. Probably like my biggest hat overall is like a coach. Like that's kind of my mindset. I need to see the vision. I need to see like what are our goals, where are we trying to get to? And then I think my biggest skill, like superpower wise, is to meet people where they're at biomechanically.
sure.
And one thing that I think you and I, one of the reasons why I think we work well together is we're totally willing to you said this once, everything you're going to learn from your patient. Like that, it's a very unique story. And I've really found myself moving into that role of like, hey, we gotta work together here. It's that desire to want to have time with your patients, to be able to really go deep and say, hey, we're going to figure this out, but it's got to be a team. I'm not going to come with the magic. I don't have a magic exercise. I wish I did.
Yeah.
You wish you had a magic wand. Pretty sure you don't, but
I do. The kids made me one years ago, and I keep forgetting to bring it into the office. Also, I know that not everybody will find that funny.
sure. And so in the space of biomechanics, yeah, just finding out where they are and being willing to try some new stuff and keep learning and keep reading and kind of going on the same journey in the systemic world that you are in the research with the biomechanics, and like, all right, that didn't work, let's pull back. And I think that's where my so I'm currently in a PhD program for mental health. I think that's really why I've been trying to figure out, like somebody asked me, like, what are you doing? Like, why are you here? And I think it's for the coaching piece. I'm starting to realize, yes, I want a background. So it's a program with a focus on trauma and healing from trauma. It's a PhD in like psychology, right? So, and I'll be a clinical psychologist in some amount of time. And but in the space of working with our population and just really anybody, I think it's that piece of bridging, like, hey, you've been deep in a hole for a while, and not that I want to, touch and explore like why you got into that hole, but how I'm going to get you out isn't just going to be movement wise. It's going to be a little bit of this, like, what do we need to do mindset work, or what do we need to do, in any host of things. But
Yeah.
yeah, I had I ended up the original impetus for going back to school, aside from I did want to have some letters behind my name, for a little bit of slight removal of imposter syndrome type stuff. And But a big piece was I was incidentally unpacking people's trauma through like this movement that we would do of like scaled and meeting it. And I think for so many people, they go somewhere and they're handed like, here's the exercise sheet if you have lower back pain. And I'm happy that we never did that. We were at least a little individualized in our old clinical days, but I still have people coming in with binders with a worth of one sheets that I can tell have been photocopied.
Yeah.
I'm like, this is probably given to a million people.
Yeah.
And they're like, what do I do with all this? And I'm like, has any one thing ever felt good? Or like felt like it's maybe not, at minimum, not hurt you? And they're like, no, it's not. I don't feel safe doing it. So that safety's kind of been the piece that I've been angling on, like the word I've been hooking onto in the past couple months of where I want to meet people. Because if we can find safety, what I was saying is in meeting people with safe movement, they all of a sudden they're moving hip joints and things, and like we're sobbing on the table. I'm like, okay, like we're here, like we have good psychologists we can refer to, and I'm like, I kind of want some tools right now in this moment that
Yep.
I'm not just like, okay, cool, here's your referral, and pat you on the back, have a nice day. I wouldn't do that, right? But that's what I felt like I was doing for people. So that was kind of the drive. It's funny because you were like, oh yeah, I do this. Now I'm thinking like, oh yeah, I've been teaching for the past 6 years too. I taught
Yeah.
in Commerce City, 3 years in middle school, 3 years in high school.
Yeah.
So that was a fun
Well,
stretch.
I mean, as a story to all of that, you took a break with my health flare up, and that was back in the day when I was just starting my practice, and we kind of needed some financial income. We do have two of our own zebras at home that are still young and under our roof, and we needed health insurance, and so it was a friend that was like, hey, we need a teacher. We need a science teacher. And it came with insurance. And you do like teaching because before that, you were also teaching. You were teaching personal trainers
Yeah,
at
I
like
like
an
kind of like
adult
a
night
like an
school type
adult
of
night school type.
level. So yeah, it's so funny. Like sometimes when I'm talking to patients, I'm like, oh yeah, I do that too. Like it's the same with you. Like you
Yeah,
just forget. Like oh yeah, that was a different lifetime, but like I did that. But you're also functional medicine trained.
yeah. Went through that kind of just behind you as you were going through, and you're like, hey, this is kind of, I don't know how I'll apply it yet, but just the schema of thinking and approaching things is kind of cool. And it's like, yeah, you are right. As I was flipping through your books, I went through that as well. So I have that holistic lens. One thing I kind of pride ourselves in is the way that we approach holistic health, and not just bombarding somebody with a volume of, or a cookie cutter sheet of, great, you have connective tissue issues, here's what we need to support with these 30 supplements.
Right, right. So you'll find health and healing in precision. You might start with, I call it like the superficial treatment, right? Like we treat the diagnosis sometimes and not the person. And sometimes that can be helpful. But long term management strategies have to be through precision of care and knowing why that person has irritated connective tissue,
Right.
which could be totally different than somebody
Yeah,
else.
like strategy exists in the precise use and action of your tactics.
Right.
So yeah, so Todd, I still will stand by this. It was kind of a cool side quest to teach because I did always want to like teach.
Mhm.
Um, but was still kind of in the clinic, couple like one night a week, some weekend days, um, during that tenure of teaching.
And
It
you
was
coached.
I
You
coached
coached.
as
Yeah.
well, yeah. So, coach, I was going to bring that up because I coached some adult endurance athletes, with and without hypermobility in their
Mhm.
lives. Um, but with in regard to the teaching, it was I knew it was time to come back in the clinic. I was ready. It was
Mhm.
kind of it was like the little side quest, but that circle had kind of come to the end, and I knew that. I mean, I feel like I belong in this office. Like it really feels like a home type of deal. I was excited to come back when I stopped teaching this past July.
Yeah.
full time.
And I'm glad to have you back.
What else? Anything that I missed?
I don't think so. I think that's a good summary. And of course, we probably both miss things.
Sure.
Right. Oh, I'm back in my PhD program too.
Oh yeah.
Integrative medicine.
Doctor.
Yeah. So that's, and with the podcast, what I'd like to do, we kind of open with this too, is really try to build on the conversations, but go deeper, right? Like, why am I having good results with non-surgical tethered cord patients?
Right.
What am I understanding about the connective tissue that I want every other professional provider out there to understand, so that more of these patients can be seen in that way, whether it's surgical or non-surgical. So, and not just tethered cord, but so many other things that we deal with too. And that's what, like, I tell people, look, I wish I could heal everything with meditation and broccoli, and we might talk about that. But in the beginning, it really is, for a lot of people, they are in like these very large chronic acute flare-ups, which if you know this population, you understand what I mean. That sounds contradictory, but no, they're like chronically, they have been at this such heightened level of reactivity that we might have to do some typical medical management. But then the conversation has to continue with, awesome, okay, so we got that under control, but how are we managing this for the rest of your life, and how are we going to improve on this? And that's the piece that I think is really missing amongst a lot of medical providers. And I think that there's so many hyper specialists out there, like even around here, we have some amazing specialist around the Denver area. I mean, we have a CSF leak center. We have somebody that specializes in head pressure. We have
We have a very
vascular
talented
team.
imaging, like upright
Oh
imaging center.
yeah, great imaging center. But when you go to those providers, right, like even like gastrointestinal specialists, right, have a lot of like medication type of recommendations, but gastrointestinal motility problems is neurological. It's not, motility is driven by movement, which is
Right.
driven by neurology, which can be up. So you don't have a lot of people that understand what are the next steps for those people. If it's kind of within my field, but like something else is influencing it. And that's what, like, I tell people, like, I know a lot about like this type of information, not much else. Not much else, but that's where you kind of have to know all of the interwoven medical things that pop up and how they are all connected. And this is, for most people, most of it's all connected. Like, we can paint this picture of a story of how somebody ended up there, and there is these common denominators, and we can work on those. So that's what we'll continue to talk about, and maybe have some people on, maybe it's from the Avengers squad that we have some of those people talk about their work. And I really like to try to go from not just like, what are the pharmaceutical options that you are using? That's cool. But why did they end up with a mast cell reaction? Why did they end up with HAE? Why did they end up with these things? And yes, genetics are a component, but not for everybody. So, like, what is it?
Sure.
So
And
that's what
even
I like
if
to explore, is people
they
that can talk
are,
about that.
yeah, even if they are a component, why then?
Why then?
Yeah.
Right.
Because
Right.
pretty sure you've had the same genetics.
Right.
Pretty sure.
Right. Yeah.
All
Yeah.
right. One thing we also wanted to do was, with this podcast, was kind of appropriately poke the bear and ask the difficult questions and kind of challenge people. So one thing we'll ask from you, listener, right now is to send us questions. Let us know what, they can be pretty focal, what you're frustrated, where you're stuck with, or they could be broad, like, tell me more about this non-surgical approach to like topics we'll cover.
Yeah.
But
Yeah.
all right. Hey, thanks for tuning in for the reboot, episode 1. We'll be back to talk about, this is going to be a good one, episode 2, about the ECM redefining
Connective
connective
tissue.
tissues.
Yeah.
Cool. All right.
Yeah.